Welcome to everyone on this Zoom session. This is one of our Zoom sessions that we have as community champions. These are part of the sessions that we are holding to address the health inequalities that are faced mainly by Black people. And as community champions, we aim to encourage everyone to stay healthy and keep everybody safe and healthy. And in addition to this, we've been running some COVID vaccines, and we are also encouraging people to take the lateral flow testing, the flu jabs, booster jabs, and all the general checks. So this is one of those sessions where we are seeking people without access to GP registrations so that they can be facilitated to register with the GPs. As we all know that it is a bit difficult when you are not registered with the GP to keep track of the COVID vaccinations and keep a record of your vaccinations if you are not registered with the GP. Because some of the challenges that we face is when you have to access some facilities, they'll be asking you if you have got a record of your vaccinations. And if you are not registered with the GP, you can't register that with the NHS as well, so that you can get that certificate that shows that you have been vaccinated. So we are encouraging all people from the Black ethnic minority to come forward, be registered with the GPs and take these COVID vaccinations. And this evening, we've got our Dr. Nhs Adeniji, I hope I said it correctly, who is going to be presenting this session for registering or seeking treatment with a GP for all those undocumented migrants and refugees. So help me people to welcome Dr. Adeniji. And my name is Lorna. I'm one of the community champions working alongside UAA, that's United African Association. So this is part of the sessions that we are doing. We are taking up to tackle the inequalities that we are facing in this community and helping people to integrate. So Dr. Nhs, we are handing over this session to you to start your presentation. Thank you.
Thank you very, very much, Lana, for that introduction. A huge thank you to the community champions, United African Association, NHFT as well, for promoting this type of program, but also inviting me to be able to speak about this really. I am keen to make sure everyone gets, something valuable from this session. So I wonder if you'd want to, if you feel comfortable, typing in chat box any concerns, any fears you've had about, trying to register or seeking treatment with a GP. Is there something you want clarified? So that way I'll be sure that, whatever we go through, I'll make sure we at least cover the questions or the concerns you've highlighted during this session. So I'm open to seeing any comments in the chat box. If there's any concerns, what has stopped you so far? What are you worried about if you register with a GP? You can pop it in the chat box. And this is a safe space, really. We're going to hopefully talk about everything you need to know about registering. I will get started. Oh, no papers, okay, yeah. And that is something we'll definitely cover. And that is something a lot of people are worried about as well. Thanks for sharing. Okay, I'll get started, but if there are other questions at any point in time, any concerns, feel free to pop in chat box and we'll get through. So registering or seeking treatment with a GP is the key focus for today. I'm Dr. Nhs Adeniji. Yes, I'm a GP and also a Ben Clinical Fellow at Northampton General Hospital, which is part of the University Hospitals of Northamptonshire. Let's see, today we'll be covering, it's okay for me to just go straight into, the topic, but I think it's essential we actually understand how the NHS works. Hopefully we'll go through some myth busting things regarding registering with a GP. I'll run you through practical tips on how you can actually find a GP surgery and how you can register. And also I'll let you know about other options that are available to you when it comes to healthcare. I think it's important for me to stress that healthcare here, we're really, really concerned about you as an individual. You don't need to pay anybody for anything, but I'll go into details when we get there. So in terms of understanding the NHS is it's a national structure, really. We've got the primary care, secondary care, and tertiary care. This is at a basic level, okay? So for some people, I've heard some people who just go straight up to hospital, to A&E if they want to see a doctor for anything. But actually, that shouldn't be your first point of call. Within the NHS, you should start in primary care. And that is where your GP comes in, really. Your GP is your point of call, really, within primary care. And they're the ones that will be able to refer you on to secondary care if we need to. And in secondary care, you're looking at maybe cardiology specialist, or, that's a heart specialist, or a kidney specialist if we need to. But within primary care, we can treat a lot of health conditions. We're trained to be expert generalists, you see. So we can treat a number of conditions and we have protocols we need to follow such that if need be, we can then refer you on to specialists. But everything starts with your GP in primary care. Your tertiary care, you've got things like, a plastic surgery unit or, a burns unit, but you don't need to worry about that. The main focus really is on primary care, and registering with your GP will get you into the system. And when you register with your GP, you get your NHS number as well. We can request blood tests, everything happens from primary care, or everything starts from that point. So yes, like I've touched on, primary care, you've got your first point of contact being your GP. And we also manage, apart from treating any immediate, health problems you have or health concerns, we can also manage chronic conditions. So chronic conditions are health conditions that are present for over a long period of time that would not necessarily be cured, but we have to manage. Things like hypertension, things like diabetes as well. So there are things we can manage, keep an eye on, do regular blood tests for you, regular checks as necessary, adjust your medications as necessary, or start you on new medications. We can do all of that within the general practice system, really. And like I said, if we need to, we can then refer you to other NHS services. And within primary care as well, you've also got, other community services. But again, though, the key point of all of this is still your general practice, the surgery. Right. And just to add on, I know some people have tried coming to me as a GP for problems with their teeth. No, please go to the dentist for that. So you've also got your dentist as well that you can approach for that if you need to. But like I said, in general, though, your GP surgery will be your key place to start. So we're going to bust some myths. Let me just see what is in the chat box. That is so true. I'll touch on that regarding COVID pass, and that is why it's also important for you to register with your GP. But I'll touch on that soon. Yes. So there's some myths, and you started touching on some of it. And based on what I've heard, because of my immigration status, I cannot register with a GP. That is not true. So anyone present in England is entitled to register with a GP, either on a temporary basis. So we're talking about those that temporary goes from 24 hours, being in the UK for 24 hours up to 3 months. Beyond that, you're not considered a temporary person at that point. So it would be a long-term form you'd complete. So you are, and as long as you're within England, you are entitled to register with a GP. So don't think that your immigration status has an influence on that. Another myth I've heard about, I need to pay money to be able to see my NHS GP, with my consent. Again, that is not true. So for your NHS GPs, it is absolutely free for you to access. Remember what we talked about, primary care, your GP. And, if you want to have consultations with them, you should be able to have that. Having said that, I need you to be mindful of the fact that nowadays there's some private options, like online, you can access. So if you're searching online, you can see some private GPs. That is not what we're talking about today. Okay, so with the private GPs, you'd actually pay for consultation, and then you can access a GP within a few minutes, but you're not registered as such with them. So in the context of today, we're talking about your GP surgery by the NHS. You see the buildings in your various communities. That's what we're talking about. Everybody has the right to access that. And you do not need to pay anybody for that. Not at registration, not for your consultations. And also, whilst we're on that, actually, regarding consultations, don't feel that maybe because you saw your GP last week for something, there's a limit to how many times we can see you. We need to see you as necessary, really. So if you need to see us again in 2 weeks' time, we would arrange that, and we can have that follow-up in place for you. The third myth: I know I can register, but I do not have any proof of ID, which they need in order to register me with my GP. Again, that's not necessary. You do not need a proof of ID, a proof of immigration status, proof of address to have a consultation with a GP or to be registered with your GP. And no GP has the right to not take you on, not register you because you don't have any proof of ID or papers. No, they're not. It's not allowed. It's a form of discrimination. So you can register, and even if you don't have your own address, you can use a friend's address, for example. In some cases, some GP surgeries would actually use their own address as well, but you can use a friend. You can use, if you go to a church, a local church or something, you can use that address, but you do not need any proof of ID, immigration status, or address in order to be registered with a GP. So don't let that hinder you. It's your right. So go to them and then sign up, really, and get registered. And no one would, the other thing is, during our consultation, so when we're actually seeing you in clinic, no one is going to ask you, oh, so what is your immigration? It does not have any impact on how we treat you or the standard of treatment we're giving you, because we just don't operate that way. So we treat you for the conditions you present with, really. When registering, and this is another myth, when registering, the form asks about immigration status, which I must complete. Again, that is not true. So yes, on the form, especially if you're filling the GMS1 form, which is most likely what they would ask you to complete, they would either give you a printed copy or they will tell you to print it online, but I'll talk you through that. There is a part that talks about, in terms of your immigration status, but you do not have to it's not compulsory to complete that part of the form. So if you leave it blank, that is fine. And again, nobody is allowed to decline you the opportunity to register because that is not complete. You're allowed to complete the form without completing anything about your immigration status. They're not allowed to ask you really. If anyone confronts you about it, just let them know. Well, they shouldn't really, but let them know it's not something that is needed. And it is clearly stated on the gov.uk site as well. So if anyone has any queries, you can always point them in that direction as well. Right. Another myth, because I do not speak English or my English is not perfect, I cannot see a GP. Not true. I've made it clear we're here for you. Making sure you get good healthcare is what is our priority. How that happens, leave that to us, okay? So if you do not speak English, you have every right to ask for an interpreter, okay? And the GP surgery will arrange this. So whether this is if you do not speak English or if there's someone that needs sign language as well, they're able to arrange interpreters for this at no cost to you. You do not have to pay anything, okay? You just need to ask, just let them know. And I know some people are like, well, I've said I can't speak English. So you can write it, you know, on a piece of paper. I might write it in the chat box. Please, I do not speak English. Please, I need an interpreter, and possibly have that on your phone, and you can just show them in case you're sure. So you show them that, and then they can always see that really. So if you do not speak English, please don't let that limit you. You can still access, you know, care from your GP. So when you're seeing the GP, what would happen is when you book your appointment, so this is after you've registered. When you book your appointment, we book a translator or an interpreter for you for that session. Like I said, you don't worry about the cost. And it will be a case of yourself, the GP will be there. It can be by telephone or face-to-face. And the interpreter will either be there face-to-face or will be on the phone call. So we call that interpreter, and then we're translating between each other until you understand what, you know, the plan is. Yeah, that's when that telephone call ends essentially. And if you need to have a follow-up appointment again, ask for that interpreter, okay? This one is another common one. So either with the GP or with the receptionist. So some people, again, with language, they feel, oh, the receptionist was speaking too fast or GP was speaking too fast. You can't ask them to repeat themselves. And I think this comes from, for some people, that mentality that, you know, in some countries that the doctor is the God. So you're too scared to just ask them any questions. No, here, again, remember what I said, you are our priority. Don't be afraid to ask. If you don't understand something, ask them to explain it again. It is your right. We're happy to repeat it or try other forms of explaining, whether it's with pictures or whether we need to get an interpreter. However, to make sure you understand and we're on the same page in terms of your management plan. I'd rather I spend that extra time to make sure you understand than for you to go home and not engage with the treatment or just not come back again to see a GP because, you know, you didn't quite understand what they said. So please, please, please don't be afraid, you know, engage, ask them to repeat. If something is not clear, make sure you confidently say, you know, ask them to nicely repeat it. But same thing with, if there's a management plan you are not comfortable with, please let them know, okay? Don't just say yes, yes. It's okay to say, I'm not sure, maybe an example, oh, I don't really like tablets. Do you have an alternative? Is there like a gel or a cream I can use instead? And those are things, so it needs to be a two-way thing. So don't be scared, okay, to engage with it, and also engage in terms of what makes you comfortable when it comes to engaging with the GP. Okay, and then there's that point. Fantastic. Now you've heard all of this, you know, you're now thinking, I would register and call my GP. Even if I have a concern at 9 p.m., I will still call my local GP surgery. Now that bit is not quite right. So it's important, when it comes to registering with your GP, find out, make sure you know the opening times and the closing times of your GP surgery. And then what happens, and you can call them within their opening and closing times. It tends to be Mondays to Fridays, and some places 8 or 8:30 to about 5:30, 6 or 6:30 in some cases. But it varies based on different GP surgeries. Now, what happens after that? You still have access to some sort of healthcare. So don't feel like that is it. But for that to work, you need to ideally be registered with your GP. So what would happen, assuming your GP surgery closes at about, let's see, 6:30 p.m. and you've got this, niggly, you're feeling a bit funny and you want to just speak to a doctor at about 9 p.m. There's a service called the out of hours service, NHS out of hours service. And you literally just call 111 and then you discuss your concerns. There's a triage system such that, if they feel you need to speak based on what you tell them, you need to speak to a GP. There are always GPs on call within the out of hours service. So you can always speak to a doctor if they feel you need to speak to a doctor. If they feel the condition, okay, we understand you're worried, but maybe it's best to speak to a nurse about it, then they do that. If they feel it's so bad, and the doctor needs to really assess, they transfer you to the doctor. So there's always some sort of healthcare service available to you at any given point in time. This applies at weekends, bank holidays, and like I said, after your normal GP surgery closes during the week. And it's important to mention that, back to registering with your GP. So if you're registered, what happens is when you call through, in some cases, not all the time, but in most cases, we can at least see what area you're registered in, what medications they've put you on. And so you don't need to always go through all of that. So that is one of the benefits of registering with your GP already. So you have that, what we call continuity of care, such that anyone looks at your record and they're able to see, oh, okay, this is what you have at the minute. Based on what you've said, I can add this medication, I can change this, I can change this, do that. And then in some cases, there are some times when, you speak to someone in out of hours service and we want someone else to check in on you. Maybe, assuming today is a Sunday, we want someone to check in on you tomorrow, that's a Monday. It's not bad enough for you to go into hospital, but we want maybe a GP to check in on you, a doctor, just make sure everything is okay with you. That's the benefit of registering. What would then happen is a message is then sent to your GP surgery electronically. You don't need to do anything. From the out of hours service, they let us know what you presented with, what your medical problem was, what they did for you, and what they would like us to check, when we call you back or, see you again. And see what I mean by continuity of care. So we can all continue your care, but it only works appropriately if you're registered already with a GP. So that information can be passed across really. And the same thing with requesting blood tests as well. So within the GP setting, if we request bloods for you that needs to be done, maybe in a hospital, getting that information across, you get your NHS number, which we then use. When you register with a GP, you get your NHS number and we can use that to do all the other things that need to be done. But it all starts with registering with a GP. And of course, like Lorna has touched on as well, with the vaccines as well, that is one of the best ways to keep track of it, really. If you're registered with a GP, we can keep track of it. And where that comes in useful is there's also something called the NHS App. So what that would do is with your COVID pass, for example, you can just download it. I'll try not to, but yeah, it will look something like that. And then you just where's that? Yeah, so you download it and you can always go everywhere show everyone around, well, not everyone. If you need to go somewhere that requires the NHS COVID pass, you can always show them the QR code, everything, all on your phone. So it's all convenient. And again, remember, key term here, or key terms, would be continuity of care. And we can all have your data in one place, and we can follow up your care that way. Any questions so far? Let me run through chat box and continue. So no papers with touch on that, you can still register. I will take your question. Muchi?
Hello.
Hello.
Yeah, thank you, Doctor. Nice to meet you. Good evening, everyone. I'm so surprised, Doctor. You talk of this perfect world of healthcare. I'm sorry to say it doesn't exist.
Okay.
I would be happy if you can share with people where your practice is. Maybe if what you're telling us is what happens, then people can flock to yours. Everywhere else, it is very difficult.
What challenges have you faced everywhere else?
Okay, I'll start with, mostly I'm talking on behalf of illegal and people with no leave to remain.
Yeah.
Because it's two different points there.
Yeah.
We have people out there, they haven't committed a crime. The only thing is they are not known by the system.
Mm-hmm.
And it is within themselves, they fear that this is who I am, and they're not prepared to come forward to ask for any form of help. Could it be financial, healthcare? They are not doing that.
Yeah.
And it is harder for them to get NHS treatment. As you said, they need to be registered on the primary front of the healthcare, that's the GPs.
Yeah.
They don't go there. Then we have people who are registered, but they do not have a status. I have been there. You go to the GPs, you want to register. They ask you so many questions. It's either you give up or you just keep going and going and going in circles. Yeah, I see you shaking your head, but that is what is happening as we speak now.
No. I know that is what is happening. No, I'm shaking my head as in I'm really sorry to hear that you're having to face that. Sorry,
I missed that.
Oh, no, I said I'm shaking my head as in I'm really sorry to hear that, but I know it is happening. I know. Mm-hmm. I know, which is why I'm trying to empower us to, because I'll let you finish and then I'll, cool. Yeah.
Okay. So as you say, we all know, we've got two devices. We all know it's happening. So I'll jump to a suggestion, then I'll continue with my statement. I would like to suggest that we have a follow-up session on today's so that we can see if we've made any progress, especially now that people know, and if you are ready to welcome some of the people who may not be registered into your practice, if that's possible. That's my suggestion. Then I go back to the statement. When you go to try and register, they ask for ID, not for proof of residence. They ask for a form of ID, passport, driver's license, or something with your picture, photograph. This is only happening to people who they suspect to be either illegal immigrants or, I think, basically people of color. That's what happens. If you are a person of color, you try and go and register, they'll ask you for that. But if you stand by, someone comes who is not the same color as you, they're not asked all those questions. So people don't register because they fear or they've been denied the opportunity. People who maybe want to push, like you said, if somebody is asking you all those things, you can say, I know my rights. Once you say that, you've gone out of books with that practice. And also because you have the fear in you that why would they want my details? Some time back, we were told that the GPs, the landlords, the banks, they've been given the power to report illegal immigrants. So it is not an easy one for someone to say, I've been told by the doctor, I have the rights, I need to get treated. I'll just say, no, you can't ask me that. Do you know where they're gonna forward your information? If you kind of stamp your authority and say, you need to register me. And this is an individual who is supposed to be underground. It is very difficult for people. So I don't know what you have got for people like that today. I think for now, for sake of progress, I'll stop here.
Thank you for sharing. What I'm trying to put up, I'm going to put up a link, and it's been designed by NHS England. And it clearly states, it's supposed to be, if you print it out, it'll be a flyer on both sides. And it gives you information about your access and the fact that your rights and the fact that no one should deny you access to registering. And if you go with that, I would be surprised. And I agree, you know, a follow-up session depends if the team are happy for us to do it. I'm happy to commit to it. The other thing I can do is, obviously I'm mindful this is not a session about my practice. So I wouldn't want to just say, oh yes, there's a practice and everyone comes to register. Because, you know, you should be able to have access. And the idea is, what GP surgeries do you have around you? But I hear what you're saying, but which is why I'm saying, yes, it's harder to go to the GP out of fear. But now I'm letting you know that fear, you don't need it, because NHS England, no one, see, on a practical level, no one, as a doctor, I see your details, you've put your address of your friend. I don't go check in, oh, so what is that person's visa status? No, I find out what your, and it's not just me, it's me and my colleagues. We don't dig into your personal history like that. Now, I know a lot of people don't trust the system. So I know there's that issue, and I'm not going to act like that doesn't exist. But I'm letting you know, realistically, it's only the fear we've got in us that stops us from registering. All you just need to do is register. Like, and when you register, you know, you have access to other things. No one is tracking you. You know, once you read, we don't track, it's not our, I know what you're talking about with the landlords as well, in terms of, you know, the right to rent and everything around that. So I understand there's that, but we don't have any of such commitment. It is according to the law. I don't know if anyone's opened that link, but it's your right, as long as you're within England, to register with a GP. So I know there's the issue around fear, but we need to, I'm hoping this session would help us know there's no need to be afraid, and just, you know what, go, because it's your health that's at stake. And a lot of, you know, I call it suffering in silence. There's no need for that. Honestly, there isn't. So I really hope you can go. So with this leaflet, let me just make sure it's the right one I've put on there for you. Yes. So with this leaflet, you've got the details really. And there's the part at the back, you know, message to the GP practice. There's that. And if anyone denies you registration or keeps asking you, in terms of, oh, where's your ID and all of that, there is, I'll need to find it and I'll possibly send it to the team and they can forward it out to everyone. There's a clear statement that says it's now an act of discrimination if they keep bugging you about it. And I don't know if you can see that document. It says there is no regulatory requirement to prove identity, address, immigration status, or an NHS number in order to register as a patient. So information is power. You've got this. Please, 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 I'm committing to actually following it up. I'm hoping most of you would go and register. With this information, print it, go there, and then show, what's happened. Sorry, show them and then let them tell you their feedback. I'm really hoping they'll be much more positive. There was another hand up. Lorna, I don't know whose hand went up first. I don't know if you...
Yeah, my hand was up, and some of the things that Muchi said, that's exactly what happens. But like you said, that information is power.
Yeah.
People, they just don't know that they've got this support from the government. I mean, there's this link that you've just given us. And what I'm actually thinking as I'm sitting here is I'm going to make sure that I send this flyer to as many people as possible, so that when people approach the GPs, they've got something to back themselves with, to actually show the GPs that I've got this that allows me to be registered. You shouldn't be asking me for my passport. And to tell you the truth, they really used to ask for passport.
I know.
I was once asked for a passport. Yes, it's not that I haven't got immigration status, but sometimes you just turn up, you think I'm changing practice. I've been registered somewhere, I'm going somewhere else. I shouldn't be asked, but you still find they'll be asking you. If I didn't have immigration status, obviously, I wouldn't have been able to register with them.
Yeah.
But now that we have got this information, we'll make sure that it gets to as many people as possible, so that as many people as possible can register with their GPs, because it's everybody's right to do that.
Absolutely. I completely agree. Thank you. Thank you, Lana. Florence. Thanks for waiting.
Hello.
Hi, Florence.
Hi. Thank you for the nice, good presentation. What I would like to say, unfortunately, what you've been saying, like what Muchi said, is not what has been happening.
Wow.
I have been asked for a passport before. When I registered to my new GP, they wanted my passport, they wanted to know my immigration status. And most of the GPs, unfortunately, they are doing that. If you are lucky, yes, you can manage to register, but most of them are asking for your passport and your ID. You've sent us a link, because if you look at the charts, I had questioned to say, is there a backup information whereby we can actually show them? Now that you've sent us a link, I hope the link covers people who are not asylum seekers, because being an asylum seeker is different from someone who's illegal. So I haven't read it. So I'll go through it and see if it covers that. Because obviously, if you're an asylum seeker, you are entitled to a GP, though most people don't know that. But if you're an illegal immigrant, if you're illegal, well, like you say, you are saying that you're entitled to register. I'm still
in the country. Yeah.
So thank you so much. That's all what I wanted to say. And it's really helpful because we are an organization and we do work with clients without any status. So like if somebody goes and they are denied, I can actually ring them myself over the phone if they are scared to speak to them. And then I can actually speak to them on their behalf to say, you know what, this article is telling us this is, can you please register this person?
You're welcome.
So thank you so much.
Yeah.
Thank you.
Release. Guadem.
Yeah, sorry. Hi, thank you for the presentation. And my question is based on a story I was reading recently, because this man came in the country for years, got married to an English woman, and then he was ill, spent months in the hospital, and then he was hit with a over £100,000 bill because he was classed as illegal. So my question is, if we are asking those people to go and register when they are underground, who's going to pay for it? Are they going to find themselves being asked to pay? Or is it actually free for them as well?
Okay, thanks for that question. So a lot of what we've covered is around primary care. So with your GP, that is free. Payment comes in when you need to approach any service in secondary care.
Okay.
Now, not any service. So A&E, for example, is free, to anybody. A&E is free. Services, including that has anything to do with like sexually transmitted diseases, HIV, TB, that is free. But if they need to admit the person for any other thing, once you're admitted within the hospital, then that is now dependent on your residency status within the UK. And then the hospital, and they have an overseas team. So for example, if you're on visitor's visa and things like that, then they start charging you for that. So at that point, yes, there's a fee but this is for those that have been admitted in hospital. I'm not talking, but right now my talk is based on primary care really. But yes, so if you need to be admitted and you're on a visiting visa, for example, then yes, the payment is there. Having said that, for asylum seekers, I know there is an exemption that's been made. I'll have to look for the link, but I saw it definitely before coming on live. So charges like that, there'll be exemptions. So they're different, that's within secondary care. So within secondary care, it all depends on the state, but let me get that link up as well. So sure. Yes, I'm looking at that now. And these are all things that in terms of supporting, yeah, that's the one. Oh no, I'll send as a direct message, I'm sorry. I'll pop that up. Okay. So that again, it has, an in-depth guide, and there's a part in the one I've just put up that tells you about the groups that are exempted from charges. And so you can read that in more detail, but that is much more for secondary care. And on that same page, if you scroll down to GP services, the first line is what I am stressing. Anyone in England can register, and I'm reading from that, and this is on gov.uk. Anyone in England can register and consult with a GP without charge, okay? So it is your right. So no one's allowed to discriminate based on the things that have been listed up there. And if you still scroll down, it says it there, NHS practices are not required to ask for proof of identity, address, or immigration status from patients wishing to register. And there's a link which takes you to guidance on how to register. So that gov.uk one, I think from what I'm hearing, I mean, I've not actually finished the presentation yet, but from what I'm hearing, I would see what I can put together, like a resource I can put together, and then work with Lorna, and then, it's something that can be distributed as well. So we can hopefully approach these GP surgeries with confidence, really, to say, as you can see, I'm hoping some of you have opened that link. It clearly states it there. Anyone in England can register with a GP. I'm conscious of time. I will quickly go through and then I'll go through the chats as well and take in more questions. Well, thank you. This has been interesting so far. In terms of finding a GP surgery, I get the impression that most people have found a GP surgery, but the problem is just registering. So do you still want me to take you through how to find one, or is there anyone that wants me to run through how to find one?
Sorry, Doctor, we have actually been working with the Hope Centre, who helped us identify some surgeries that are taking people that are undocumented. I've put it in the chat, so it's the last message.
Fantastic, fantastic. Okay, great, thank you. At least that proves my point that I'm not making that up. Great.
Doctor, we have someone who's got their hand up at the moment.
Okay.
Yeah, that was Ariel.
Hi there. Hi. I'll just introduce myself.
Hi.
My name is Ariel Abel, and I'm the new volunteer regional caseworker for the Northwest for BAME Hub UK. Thank you for most helpful and continuing ongoing as it is the presentation, Doctor. What I'd like to say, just to share a couple of things. First of all, it's extremely helpful to know what is helpful to take along, such as a utility bill, because the idea then is not to prove what I suspect that sometimes GP surgeries are trying to cover their back over, which is a question of access to public funds. And again, the very root of it, and having to ask people just because of their origins to ask them questions that they wouldn't ask other people of other origins is in itself, of course, through and through racism. I just wanted to point or just make the comment that I've had certainly the experience knowing that not only is it a question of whether or not a person is of a certain color or origin or race, but even to have a certain foreign accent or immediately triggers all sorts of presumptions that are made, which are completely and utterly wrong. And this I've seen to be the case outside of the experience that of course you have a great deal of in the area of GP surgeries in universities, whereby actually my wife, who is from South America and has excellent English, but with an accent, a strong accent, had year on year to prove that she was a UK citizen when I didn't. And I went to university with her. And she'd been here for 25 plus years. So it's very sadly a very ingrained sort of attitude. So thank you very, very much for that information. The leaflets that you have, I'll forward them to make them available and at hand amongst the pool of documents that we have regularly, so that I'm sure they'll come into immediate and very relevant, significant assistance when people turn to us for help when they're finding difficulty getting their roots put down in their locality. So thank you very much indeed.
Thank you very much. Thank you. And I think it's important on a real level, really, for me to stress that I don't want it to seem like I don't know what challenges we face. Oh, I still went to have a COVID test done the other day. And for different reasons, I had to go with a taxi driver. And I got asked about my passport. And apparently, the taxi driver was so upset. He said he'd brought other people here and nobody has asked them for their passport, really. So he was furious. So I don't want you to think for 1 second I'm trying to act like life is all perfect and, you know, those challenges are not there. No, I can relate to it. It is there. But it's that confidence in saying, I know what my right is. These are the things I need to use to register. I filled in the part of the registration form that I must complete. it's now your turn and you cannot deny me. And if you want to deny me on the form, the assets one, it clearly states there, if they decline you, they need to send you a letter as to why. They have to justify it, which in most cases isn't. It's an act of discrimination if it's based on your status. So I want you to go with that confidence, really, because every day we still get that. I talk to some people, even my accent is not full on British. Let's face it, it's not full on British. So I sometimes get that, and then they realize, oh, it's a doctor, then oh, and then attitudes change. So I want you to be mindful. This challenge it's in our way every day, but it's being empowered with the information to be able to approach these services, know your rights, and then you can operate from a place of confidence, really, in terms of what is your right. Okay. Thank you so much for that, Ariel. Let me just... Okay, so in terms of how to find a GP surgery, I put up the link there, but I also put it into a QR code if you just find it easier, scanning that. And then all you can do is just put in the postcode around where you are. No one is tracking it, okay? Put in your postcode and find the ones around you. But I love how we now have a list of the ones that actually, the GP surgeries that have been open enough to take on new registration. So it'll be good to engage with that list as well. If you haven't seen it, I think Anne put it in the chat box as well. So please utilize that as well as an option. So you can either register online. If you're struggling, you can call them, email them, and ask to be registered. And then, sorry, just put that up. And I've said, avoid going to the surgery. I mean, because of COVID at the minute, but if you want to, you can always do it, really. But you can just download the GMS1 form, complete it, take it there. Like I said, you do not need that proof of ID. It's on the links I've sent out to you. It is clearly stated. There's help available if you're struggling to fill the forms. It looks like we already have some services, and it's one to utilize. But I've also got contact details for CAB, so that's Citizens Advice Bureau, if you want to engage with them. I've put the asterisk beside this is across Northamptonshire. I've put the asterisk beside the Daventry one because I know they're now open to face-to-face options as well, if you want to just call them, talk to them, or go in and see them. But you can go online and check out the information there as well. And in terms of other healthcare services for you to access, again, at no cost. But the main thing really to benefit from everything else I'm going to quickly touch on would be registering with your GP. Once you have your NHS number, the rest becomes easier. And like I said, we are not there monitoring what your status is and all of that. No, it doesn't change any of our management. So NHS 111, we've talked about already. Again, even if you're using that service and you want an interpreter, please empower people around you. It's okay to ask for an interpreter, even if it's by phone, and that can be sorted. Your pharmacy, you can always engage with them. The sexual health clinic as well. And again, that is for free, but remember what I said, register with your GP, have your NHS number, and then the rest should obviously fall in place. But these are the range of services available, through the sexual health clinic as well. Mental health support as well, that is also, so you don't necessarily need to always wait to speak to your GP. But the good thing about being registered with a GP is your NHS number, they're easy to find you on the system, and then whatever their plan is after they speak to you, they can always just put it, like inform your GP as well about it. Not inform as in from a bad place of wanting to report you. No, it's again continuity of care. So we have beyond there, you already spoke to them, they've offered XYZ, And, you know, we can always follow up if need be. So you've got that telephone number there and you can access that. And this is particularly for Northamptonshire. And obviously in the event of, you know, any urgent medical attention, I'm talking about someone short of breath, gasping for air, cannot breathe, chest pain, anaphylaxis. So maybe you eat something and all of a sudden everywhere starts, all parts of the body start swelling up, you know. Yes, you need 999 at that point, really. So I'd rather you engage with them at that point. And that brings me to the end of the presentation, but I'm going to go back to the chat box and run through all the questions as much as possible. Okay. So I think getting a COVID pass, again, we've touched on the benefit of that. You can download the app once you have your NHS number because you're registered with a GP. How best can someone challenge the surgery if asked for? You've got that power now, so that flyer is there. But I really would, off the back of this, because this is something I'm passionate about, just, you know, addressing any sort of inequalities, because everyone should have access, really. I would see what I can drag together so it comes as one pack, really, and then you can pick what you need from that pack. Again, I'll work with Lorna and Anne on that and disseminate as possible. I would like to think these individuals can get the COVID vaccine, but some are scared that home office vans will be there waiting for them on site. So please, what is your advice? It goes back to what I said about, thanks for the question, but it goes back to what I said about we're not there monitoring. So if you've already, look at it practically, if you've registered with your friend's ID or your friend's address, it's not, as GPs, it's really not our place to then start, you know, chasing up. Or no, it's not our place. I understand people are scared, but in reality, I can assure you on a practical level, if the Home Office wants to track you, they have other ways of tracking you. I'm sure they have other ways, not just waiting till when you would come to a GP surgery to get the COVID vaccine. And the interesting thing is with the COVID vaccine, obviously you get to pick when you want to, it depends on how your GP surgery does it. But you can obviously pick when you want it. But also some places have developed centers like multi-impact center where it is not linked to a GP. Yeah. So if you want to get the vaccine, which we encourage you to, it's not necessarily linked to a GP surgery. So you don't have to do it at your GP surgery. There's a pharmacy that does vaccines as well within our area. It's not a GP surgery. So I need you to think of, yes, you can get the COVID vaccine, but it doesn't have to be at your GP surgery. So there are other alternatives, like I said, you know, multi-impact is one that comes to mind. You know, a central place, different people can come and get their vaccines, and no one's really tracking as such, really. But like I said, honestly, I believe if Home Office wants to track you, it doesn't need to be based on a GP appointment. We know patients who are not offered interpreting services or support. Oh dear. People are not aware and many people struggle, and GPs and nurses, are not offering. What can we do as community champions if clients tell us they did not understand what the doctor said? Interesting you touch on that, and that is so true, which for me is why I continue to stress it. What to tell them, I think for me is creating, and that would be something that will need to go into the pack. I think I need to have a separate conversations with the community champions and United African Association. We need to create a pack such that in there will be something that says something like I said, please, I do not speak English. Please, I need a translator, I need an interpreter. So people will just confidently show that. Once they show that, because one thing sometimes we don't realize is sometimes the receptionist just assume, and I'll give you an example of, I don't know how I'm doing for time. Lorna, and how am I doing for time?
We're still okay.
Okay.
Yeah, I think,
Okay.
yeah.
Yeah. Okay. And I just want to give you practical examples. So sometimes I've had instances of patients you see them, they're fine, everything's fine. The receptionist make an assumption that they just speak English and they're fine. But actually, these are patients that are deaf and dumb. And next thing, you're booking these patients with me without any clear, idea as to, so I now see this patient, I'm asking questions, but we're not talking. And then we realize what the issue is. And then we now need to arrange interpreters and all of that. So I think we also need to bear in mind, sometimes these people might be too, the staff might be too scared to ask or assume, you understand and everything. So I think it would be lovely if we can create some sort of pack, like a card, and they show, please, I do not speak English, please arrange an interpreter or something like that. And they can show that way, any receptionist, anyone should be able to arrange an interpreter. And that way they would have access to care. So I think I need to work with the community champions if you're happy for me to do that, really, and develop something. Even as a professional, find this happens all the time, them talking too fast. I always request them to slow down and repeat. That is good. That is good. It's your right. But what I see sometimes is a lot of us feel, okay, we can't ask them. We accept it and we just go. We don't do anything they say, and we don't come back to the GP either. But please, it is your right. Ask them, please. I didn't understand. So what is happening now? And then what will happen? And then what date am I coming back to see you? Make sure it's very clear. Okay. Thank you. Thank you. It's our responsibility to offer chaperone. Yes. Or look for someone who can chaperone those struggling to understand what their GPs are saying. Yes. But the issue is, for some people, they don't always express that they didn't understand initially. So yes, it's as community champions, that would be amazing. And I think for everyone on the call today, it's important to stress, it's your right to have a chaperone if you want one. Okay, so some places they might not even ask you, but make sure if you want a chaperone, and I want you to empower people you work with as well. If they want a chaperone, they should ask for a chaperone. Especially with intimate procedures as well. Make sure, you ask, and it's everyone's right to do that. And I know it all sounds wonderful, but the reality is that is what we do on a day-to-day basis. But because people don't always, not everyone engages with it or thinks they can ask for it. So some people make an assumption, but I always check if people want chaperones or not. You need to have a GP, but problem is my status and not knowing how to start it. Oh, do you mean status? Okay, so I'm hoping you're able to scan that, the QR code I put up there. You put your postcode there, and then you literally find that GP around you. Please, I would say on that, when you find a GP on there, there'll be some negative reviews. Don't always judge a GP surgery by the negative reviews. A lot of times, and I'm sure you know that, sometimes we make conclusions based on, or we go in online to put in comments, really, just after a bad experience or something. Doesn't mean that is everybody's experience. Okay, so see what works for you, but register. You can either register online or find their address on there and go to them, say, please, I want to register, and they should give you the form. Or you can just print the GMS1 form online and then go to them. Hi, do we have a document to back us that we can register without an ID? So I've given you gov.uk, because people are asked to bring their ID, so we can challenge to see accordingly to article this. I can register without an ID. I think we've got that covered. If someone is vaccinated from abroad, how do we get to show it on the NHS? So if you're vaccinated from abroad, you should have some sort of evidence. So a lot of places, and you'll have the QR code as well. So whether it's a card or an app or something, you should have that. And then if you let your GP know about it, they should be able to update the system to say you've done it abroad. But you should have that evidence from whatever country. Every country has been having that so far. Proof of ID issues, I can see that is a resonating theme like Muchi raised. Okay. ID, like I said, you done a lot. I went and asked, I agree with Muchi as this is happening a lot, but I went and they did not ask me for ID. So how do they ask different people for ID? Oh, that is great. Thanks for sharing, Emilia. One person that confirms, they haven't, asked for ID. But I guess, the practice for some people, for different experiences, not everybody is getting the right experience that we want, but which is why this session is being held to say it is your right, go there. What will happen to those who have been vaccinated through community after registering with GP? Will I need to be vaccinated again? So I don't understand that. You've been vaccinated with the community after registering with the GP. So which is why it's important to, like I said, I touched on. So if you're registered with a GP and you get vaccinated anywhere in the community, because you have that NHS number, because you registered with a GP, we get that update on our systems. So you don't need to do anything. And no, you won't need to be vaccinated again. Okay. The links. So does it mean that illegal immigrants can register with GP with no problems? Anyone, like we read in England, can register with a GP. The Hope Center, yes, so that has been useful. So please get those details really, including in the list of GPs that can help. It's been recorded. Anna's put that up. Thank you.
Yeah, Dr.
Center. Yeah.
Come in. I think the person who put up a question about those who have been vaccinated with the community champions, because we have been holding some vaccination sessions, and we have some people who are not registered with the GPs, and they've been vaccinated. So I think this person was asking that once they've registered, because they have been vaccinated already, do they have to be vaccinated again? I think that's the question.
Okay. Thank you for clarifying that. So no, the answer is no, because we should be able to update our system to say, you have been vaccinated. So once you register with a GP, we can update that to say it has been done in the past. Because I'm sure you would have some sort of evidence, whether it's the card, that has been signed, there must have been something given to you to prove that you were vaccinated. So that should be fine. I think I've covered.
I have a question.
Yes.
Yeah, having said about vaccination, there is somebody who went to the doctor. They had 2 vaccinations and they were refused because they were vaccinated abroad. They showed everything, but still refused. So how do you go about that?
They were refused what, sorry?
The booster.
Oh, did they clarify why they were refused the booster?
No, they just said they couldn't trust, yet they had the proof on their phone and everything.
Oh.
They registered from abroad, having had their first vaccination.
Okay. I think for me, what I'd say is the likelihood of that just being declined is slim, but the reason would be 6 months. Ideally, no, the idea is you shouldn't get a booster until 6 months after your second vaccination. So I think I would want to check, just being objective, I would want to check that person's last, when they had their second dose. And if we're still within 6 months, then that would most likely be the reason. I don't know if you understand what I mean.
I do, yeah. But I think they said to me, it's over 6 months. So I don't know why it's only that they didn't believe that it was genuine, whatever they were showing. So hence, maybe, as you say, sometimes race, color does affect.
I would need to say, yes, those issues are still present. There's no trying to hide that under the blanket or anything. But really declining it, I would want to look into that, in more depth, really. If there's any way I can help, I'm happy to be.
Okay, I'll find it because I'm in contact. I'll do that and then go through Anne.
Okay.
Yeah. Thank you.
You're welcome. Muchi?
Yes, this time it's not a question. It's actually a suggestion.
Yeah.
10 years ago, I lived in Leicester and my situation was precarious. We had a place called Assist. Assist was a place where anyone with no papers, any asylum seeker, anyone going through hardships could go. They had doctors ready to take and help anybody. So I'm just thinking, this goes to Pratima. She's our lead. How can we fight this problem? Because to be honest, I think this problem of GPs and asylum is political. So Pratima, I'm putting it across to you. There is a place in Leicester called Assist. That's refugees and asylum seekers. You don't need to go to any other GPs. You just go there, they don't ask you anything. You register, you get treated. And there, because mostly it's people of color, you meet people of color there. There's no discrimination, nothing. You don't need to explain anything. So this just popped into my mind and I went through this. Why can we not push for something like this as community champions? I don't know. It's just a suggestion.
Yeah, Muchi, I honestly, I agree with you because I kind of, even Doctor, you've agreed that, the levels of discrimination are so significant, in everything you've said, and some of the questions you could tell people are just not getting the right services. I'd be more than happy to look at those kind of services that we need to provide here, Muchi. All of these things take time, but the reason we've set up Northamptonshire Black communities together is to get the right services for Black communities. So more than happy to look at that, really. Anything that helps. And even David's question just now is just shocking. If people are not getting vaccinations based on the proof not being right, if like you say, you need to get into the details of that case, but if that is the case, that's appalling, really appalling. And we need to get the whole population vaccinated. It's the biggest priority in this country, and nobody should be even feeling that they can't get a vaccination. So yeah, I think we should look at anything that helps, really.
Yeah.
Okay, thank you.
Thank you. And I just want to say off the back of this, so yes, I want to commit to putting together the pack, and I'll be in touch, but also in some way, shape or form, communicating to GPs across, Northamptonshire, and seeing what we can do, really. But at least just letting them know, these are issues that they need to actually, as partners, they need to actually take a bit more. I know they take it seriously, but to be aware of what people are going through practically, because there's something that is theoretically being said, but to make sure we're all following through at every level, really, including our admin staff. So I would see a way to pass that across, and when that is done, I would let you know. And I'm committing to a follow-up session if people want to sign up and see.
Doctor, is there a way of kind of registering some of the issues, especially from this meeting, with the CCG in a kind of more formal way? Because I know, there's so many important questions that have arisen, and you've answered them really well. But is there a way we can kind of just do a short report to the CCG for them to take account of this?
Absolutely. So with CCG, obviously anyone has access, but in terms of highlighting it raising it with the right hierarchy, really. If you want to put a report together, I'm happy to put my bit to support it. And then I would, forward that on. Yes. And, get things moving, really. At least we need to address these things, health inequalities. We need to begin to actually face it, really. Yeah.
No, your help will be really helpful, I think, in that. Thank you.
Any other questions? Okay, I think that is it from me today, but thank you so much. Thank you so much. And I think the main message really is there's the information there. I hope you're empowered. You can register with your GP. Please utilize it. And I look forward to seeing people actually register, when we have our follow-up session.
Yes, we certainly hope so. Thank you very much for that, Doctor. We do have Lady Relisti on who actually did ask a question a bit earlier on, and she's a Black counsellor. So if Relisti, if you want to make an introduction of the services that you are doing for the Black community, the African Caribbean community.
Okay, hi, thank you for that. Yeah, my name is Release, and I work with Northamptonshire as a counselor to provide psychological mental health support to anybody in the Black community. So we often go through mental health distress, and we don't have anyone to talk to because maybe we are scared of being judged, or we don't want to talk about certain things with our friends or family. So the service is there free of charge for whoever wants to access the service. So I don't have the link on my phone, but and please, if you can just put the leaflet in the link for people to use and distribute. And we're here to support you, myself, and there's also Koshika, who's dealing with the Asian side of it. We are here if anybody needs help and support with their mental health. Thank you.
Great.
Thank you, Relist. Thank you. Anybody got any more questions? Otherwise, we'll get Lorna to kind of close the meeting and give us some a COVID safe message, if not.
There's a hand up from Chichi. Okay. Chichi.
Hello, please. I kind of joined late. I've posted my question on the chat session, but I think it's been answered. So, but I'm just wondering, how do we get the recorded message so I can be able to listen to it, because I've missed most of what is being said, please?
Yes, Chichi, I will get in touch with you. I have your number, so I'll get in touch with you. I'll send you a link. We will be putting this on our Facebook and website and yeah, other media. I'll get in touch with
you. Okay, please. If you send to me, I will really appreciate that. Thank you very much.
Thank you.
May I take this opportunity to thank you, Doctor, so much for this presentation. You just have no idea how much you have empowered us. I just feel like standing on the rooftop and scream at the top of my voice so that people can hear that they can actually go and register with GPs. And definitely, we are going to make sure that this message goes where it's supposed to go, and people can start registering without fear of being intimidated or whatsoever. And we'll make sure that we will circulate the leaflet that you have given us so that at least people have got something to back them up. Yes. We just want to remind people that these are times of COVID. We need to continue to do our lateral flow tests, to keep our masks on, wash our hands as much as possible, and keep sanitizing. Let's keep ourselves and everyone safe. And the vaccination clinics, They are ongoing, and we'll be distributing some leaflets. We have got some dates that are lined up where we are going to be doing the vaccination clinics, and we'll make sure that you get the information through the WhatsApp groups, those leaflets that we're going to be distributing. Please come and get your vaccinations. Urge other people to come and be vaccinated so that we keep and maintain a healthy nation around our Northampton. Thank you so much, everybody, for your attendance tonight. Pratima and Annie, thank you so much for coming up with this Zoom and for inviting Doctor to come and share with us. We feel empowered, and thank you once again.
Thank you very much, Lorna. Our next session is in 2 weeks' time, and it's on heart disease. We did have a missing session from Dr. Gardia on prostate cancer, which we hope will be put on again. It's just due to health issues at the last minute that the session was cancelled. But the next one in 2 weeks' time is on heart disease. So please log on, please share the leaflet, and I'll be putting it through the normal channels. Thank you so much. Thank you. And Pratima's put a last message on there saying today's announcement is that anyone over 40 can have a booster vaccination. So please encourage everybody to take their boosters. Thank you so much, Dr. Adeniji. Thank you.
Thank you very much.
Yes.
Have a good evening.
Thank you.
Doctor, that was really useful. Many, many thanks. Really good.
Thank you.
Thanks, everyone.
Thank you.
And
Thank you. Bye. Thank you, Doctor.
Bye-bye.
Thank you, Doctor. Bye-bye.